So Varda, you do have brain salad, huh?
Yeah, I love to mix things, mix salad.
Well, it's it's like me. I like to mix things, but the guys usually put it like in a better words, like connecting the dots. We connect, we mix the things, and then we make something great.
Connect it in 3-dimensional way.
In 3 or 5, who knows?
I agree. I agree.
Okay, Amsi, let's do it. So welcome to all of you to our new edition of Leaders Who Have Something to Say, the place to get inspired with outstanding leaders' actionable advice. I'm Mariana Ferrari, and I'm your host today. With me, Dr. Varda Shalev. She's the CEO of Alike.Health and professor of epidemiology and big data at the University of Tel-Aviv, with whom we're going to talk about big data and ethics, 2 words that for me are very big. Dr. Shalev is a family care physician and also a data scientist. Her company, Alike, is empowering patients through data that matters, which is our own data. In the control room, we have Amsi Jackson, our executive producer, our outstanding producer, I should say. And most importantly, in the chat, we hope to have all of you ready to start firing your cues and comments. Varda, it is such a pleasure to have you here with us today, all the way from Tel Aviv, and to talk about something that is so important, which is healthcare. Now, healthcare is an industry that is growing immensely, thanks to research and technology. So I believe that our conversation today, it's going to be so good. I'm so happy to have you here.
Thank you. I'm happy as well. I'm really excited.
Oh, thanks. So listen, should we start with the basic? This is not something I do, but I love your company. So can you explain the audience what is Alike, your company, and why it is narrowing the gap between developed markets and developing economies in what it relates to healthcare?
Yeah, actually, in Alike, we connect people based on their personal data. It's their electronic medical patient record data, as well as social determinants, preferences, and more. So we take the patient 360 degrees all around, we look at him and we connect with people that are alike, and we let them learn from each other because we understand. And I develop systems, decision support systems for physicians and for organizations for many years. But it took me years to understand that we don't do enough for the patients because the patient have so much time and so much engagement that we should provide him with tools in order to manage his own health and to help others. Because we as physicians, we don't have enough time. Sometimes we don't have enough incentive even. So we want to connect the patients to learn from each other, to help each other, and together, the physicians, with the patients, with the organizations, we can do a lot more. And there are countries.
So give us a very concrete example of what alike means. Like, for example, do you get the DNA of a patient and everything around it?
We start with electronic patient record. There is a new law in the US, the 21st Century Cure Act, says that each provider should provide all the medical record to the patient in a certain format. standard format called FIRE. So what we have done, we have built an application that lets the patient go to his provider through the app, sign a consent, and then the data goes to Alike. So we know all the diagnoses, labs, medicines, procedures, and more. And we can actually take it and build the patient a new electronic patient record with his preferences, hobbies, diet, and more. And then we can connect him to patient like him. So we don't start with genetics, we start with his electronic patient record, preferences, hobbies, diet, sports, and more, and we'll get deep with the years more and more.
Okay, so I do remember that in our prior conversation, you were sharing with me the example, like, for example, say that you have a heart disease and you are a certain age and a certain ethnicity and, and possibly weight.
Yeah.
I don't remember exactly all the data that you were sharing with me. And you said, and you might benefit from connecting to someone that's like you with that same type of data. And that,
I agree.
that can share the experience.
Today, I totally agree. Today, when we are in the Corona time, we all understand that if you have Corona or COVID, even if you are the same age as somebody and the same gender, it's not enough, because if you have hypertension or you take certain drugs, the future of you two is totally different and the prognosis is different. And so you want to talk to somebody who went through the same journey with the same background, comorbidities, preferences, and learn from him. And sometimes the patient can teach you things that we as physicians, we don't know them, many tips and what he did. And if you take, for example, drugs for Corona or for COVID, you should avoid certain other medications. And you want to understand from people who had the same medications, what did they do? How did they manage without the medications? Many practical issues that you can learn only from somebody like you. And by the way,
especially, sorry, I was going to say, especially in a pandemic where everything surges so fast and there's not really experience from the medical providers to know how to treat this or that. They even didn't know on the beginning why were some patients dying and some others weren't. Remember?
I agree.
Men instead of women, old people instead of young people. Yeah.
Yeah, so and people feel, even without the Corona time, that we don't look at them holistically enough. They say the physicians are looking at me vertically. I went to the ENT and he looked at my ear. I went to the ophthalmologist, he saw my eye. But we look at the application at the patient holistically, like I look as a family physician on my patients with all the dimensions. And then we connect the patient. And I think that's what's unique about Alike, that you can see somebody going in a journey that you are just entering to this journey behind him and you want to learn more. If you are going to have a new drug or a new procedure, and you just learn from the one who went just before you.
Okay, so I want to remind our viewers that you can start shooting any questions that you may have, because I have like 200,000 questions for Dr. Shalev today. So if you want to share your questions or your comments, please feel free to do it at any time and we'll get through them. Remember that you can do it both from YouTube and LinkedIn. So, whichever is easier for you. But Varda, I also had another question for you. When we did our prior interview, you mentioned that that big data brings opportunities to patients. Now, which opportunities arise from big data?
I have a clinic and I have a huge clinic with a partner for many, many years. And we have 3,000 patients almost. With big data, you can look at millions of patients, and you can really find someone like you. In my clinic, I hardly have patients that are almost alike, but in my data, in Alike, we have already 40,000 patients, and soon we'll have 100,000 and a few million. We just started to scale, okay? And for when you have so many patients, you can really look at all the dimensions and understand, because you know, medicine is very complex because there are so many dimensions in a person, a lot more than in a car or in an airplane that we want to do automatization there. Here, in order to have all these dimensions, you really need numbers, you need big data. Okay. And that's what we try to have this data, to anonymize the data, because we look at privacy on the same place, so on the first place. So when somebody is onboarding, we just take the data, we anonymize it completely. We don't know who is this patient anymore. So you can talk with the same person on real data, but anonymized.
Well, that brings me to my next question then, which is the ethics part. And we were discussing that big data is a double-edged sword. The ethical and also the legal implications and challenges include the risk to compromise your privacy. I mean, in many ways, personal autonomy to make decisions, ensuring equality. For me, that's a big one. Then the decision-making about a patient, like receiving or not receiving an organ, for example, at certain point, because of what you might have. So what do you think, how do we put together big data and ethics?
Yeah. Actually, we always have to think that even if you think that I have something that is not really privacy issues, like diabetes or hypertension, it can be very private to me. And when I look at the patient data, it's like holy, okay? We have to really think about privacy and keep it from others. And that's why in Alike, when we take your data, first we do informed consent. We explain you what we are going to do with the data. We are not going to sell the data. We are not going to show anybody private data, never. And actually my partner was the president of Checkpoint, which is a cyber company that they actually know exactly how to deal with data, that nobody will be able to bridge it, okay? So that's what we do. And sometimes you don't ask questions about your health because you're afraid to ask it, because then people will know. If you go to Facebook groups and you want to ask something, you say, you know, it's my privacy, I don't ask. So in Alike, you can really feel comfortable that nothing is bridged. It's totally anonymous. We even change a little bit the dates. So even if somebody will get this data, he will never be able to know who is this person behind this data. So actually,
okay, and how do you build trust on what you're saying? Because I don't know, there's a lot, of course, as with everything right now, everything that is important, there's a lot of crossing information, you know. So how do you bring trust? How can people trust that what you're saying is in fact a fact?
Yes, so first we are compliant with HIPAA and GDPR, of course, and I'm a physician, you know, so today I had my clinic in the morning and I never forget, and I start the day with the clinic, you know, so I'm first a physician, not first a data scientist and not first a technologist. I do it on top of being an active physician, and I see the patients on a daily basis, and I think it reminds me what's important and where do we have to go. And I see actually that patients need more data. they don't trust us sometimes. They have more questions, and they need to talk to patients like them and to see the data. And also, as a physician, I think my best partner is the patient. I can't do good medicine, provide good medicine without the patient's help.
You
And
know what
that's
I'm
why
thinking? I'm thinking that this is my brain salad. Okay, so it's creating something, but I believe that you're going to like what I'm creating with my brain salad.
If it's a salad, of course.
Yes, it's a good one. I think that what you're creating somehow with Alike, it could be compared with the next generation of Google. Why do I say this? Because when as patients, we have any fear of a diagnosis, the first thing that we do is we go to Google and find out information. And sometimes it's very complicated information. And sometimes if people are smart enough, I mean, they would go to very good information places like the Mayo Clinic, for example, that has a lot of patient information for the patient. However, that's general information. Now,
I agree.
With
When you
your
go to
Alike, wow, it's blowing my mind.
Even when I, as a physician, go to look for information on a patient of mine, okay, and I go to UpToDate or to Google or whatever, it's very difficult to find a relevant information because many times I look for certain age or gender or combination of two comorbidities or a certain preference of a patient, and I can't find it. That's why in Alike, you can look at really, you can Google on patients like you. It's like Googling on a concrete data that you are looking for. And we don't have it these days. And so that's why when patients come to us with Google, we many times tell them, no, it's not relevant for you. It's not relevant.
Yeah.
Something else.
And sometimes they come very scared. I'm sure, right? So it would be like combining the big data with the artificial intelligence plus the data provided by, well, in the US, it would be provided by the system, but if not, can it be provided by the patient?
Yes, of course. The patient can enter the data manually.
Okay.
If he doesn't have his electronic patient record. And we see that patients, you know, the granularity of the data is getting more and more with the time, you know. So if somebody in the past said, I have psoriasis, now he says, no, I have guttata psoriasis. I want somebody with guttata psoriasis. So we started with 500 kinds of conditions, and now we have 2,500 already. And we are growing on a daily basis because we see that we need to be a lot more granular. People want to find somebody exactly like him.
And I'm still combining the ingredients in the salad. Is it going to be open to physicians as well?
You know, it's open to physicians like patients. It's not that we are building it for a physician, because, you know, there's really tension within the system between the physician, the patient, and the organization. And here with this tool, we are building it for the patient. We want to be very objective to the patient. That's why we don't sell data. We don't take the data to physicians for approval. We do it with patients and for patients. It's only the patient side. And they can come to the physician and ask them questions and precise questions based on this data.
Okay. And so that brings me to another question that it relates to the ethics, to the trust, you know, and I believe it's being very clear about what is, in this case, your business model. You know, who are you taking money from, or who are you going to be taking money from? I mean, is it that you're going to charge the patients, the labs, the physicians, or who's going to pay for this amazing service?
So we don't charge the patient and we don't sell the data. we, at the moment, we collect more and more patients within the system, and then we want to refer them to a marketplace, like medical devices, like helpful solutions for their situation, because we'll know exactly who is the patient and what can help him, and then we can refer him to this place, okay, device.
So again, we're talking about the next Google, the Google of healthcare.
Right,
Because,
it's a combination of Google and Facebook, but it's anonymized and very precise, okay? That's what we try to do.
That is outstanding. And that, if we go back to my first question of how do you flatten the world with, you know, with your company, once you start opening it up beyond the US, how do we access Alike? I mean, as a patient, what do I have to do to put in my information?
So actually you go to, if you're in the US, you just go to the App Store, you write Alike.Health and you download the app, and it's very easy. You can connect it to your provider, or you can enter your conditions and procedures, etc., manually. At the moment, it's only in the US, but we are going to start a project with the larger HMO in Israel, which is more than half of the population of Israel, more than 5 million patients, in a few months. And then we'll go to other countries, because we want to flatten the world and to bring people from many countries together to help each other. And you know, many times I ask myself whether people like to help more or to get help more. I don't know, because people, when they had a medical problem, they really want to help others. They really feel
absolutely. That's why the patient associations they work, right? Whenever, to share, to get help, and to help. That's basic human being, right?
Exactly.
Yeah, well, that is outstanding, Dr. Shalev. I believe that you're, you know, if you're open for investors, you should let us know, because if you know what I love from your story, that you started this company being a physician, and you're still a physician. You're still working the entire mornings as a physician. So that is great.
Yeah, so, actually, most of my insights came from my clinic. So many things that I wrote about in research or developed as algorithms came from real patients that I saw it on the clinic. And I've learned so much from patients that I think that now they have to learn from each other too. We also learn from patients a lot. Many times they teach us lessons, they show us things. They have a lot of time to dig in their data and to ask smart questions.
Yeah, sometimes doctors do not like smart questions from patients, I should say.
Yeah, I understand what you say, because many times the questions are very, they are not close to reality. That's what we try to help them, to ask questions that will help them. I think that if a patient is not with me in the disease and he doesn't know enough, we'll never solve the problem, we'll not get ahead, you know.
Okay, so let me, as we're closing down our interview, I wanted to ask you also, so if I'm, as a patient, go to Alike now, you know, that you're starting, I mean, you have 40,000 subscribers. It's not a startup anymore, but kind of. What benefit? What do I find there? What benefit would I?
So, for example, if you have migraine,
yes,
and you said to your doctor, you know, this didn't help me, and the Imitrex didn't help me, and the paracetamol didn't help. What can I do? And he says, you know, I don't know what to offer you. Then you can look at the drugs that patients like you are taking, same age, same gender, with the same comorbidities, because it might be that you have migraine and hypertension and something else. Okay. And you can see how patients like you are treated. And you can read about these drugs. Everything within the app has explanations on each drug, on each class of the drug. And you can go and discuss it with your physician and read. And
And as a patient,
patients.
Can you share your experience? Like, for example, if something worked for me, can I share it there?
Of course. We do natural language processing on everything that is in the feed. Your feed in Alike is very personal for you. So you see a feed that is personal to your condition, age, and gender. And we analyze the data all the time. We do natural language processing, and we help others get insights from what you are writing and get insights for you from others. So we combine between the data that each one is investing within the app. Okay.
So what is your website? We're going to share it later anyway on the chat, but what is your website?
Alike.Health.
.health. Okay, Alike.Health. It's pretty simple.
Yeah. And also in the App Store, Alike.Health.
Okay, that's great. And that's for America, but we have to wait. The rest of us are not in America. Well, I'm kind of like back and forth, so I can go. But AMSI, for example, can get it. Yes. The other day, I was sharing your story with someone, and I don't remember. It was a group of friends, and someone said, "Well, I'm so afraid of everything, that related to my health, that I'm not sure that I want to get there." And I said, I think that's where you have to go, because if not, you'll go to Google, which is not always going to offer you. Yeah, it's not going to offer you your personalized information, right?
Yeah, actually, when somebody if you are afraid and you get a new medication, you really want to talk to somebody who tried it, and is your age and gender and your same condition. It's so natural. If you're going to have a total hip replacement and you are a bike rider, you want to talk to somebody who's
a bike rider.
A biker, and he went through a total hip, and to ask him, how long did it take you to get back? What did you do? What helped you the most? I think it's so natural to do it, Sometimes I can't answer how many weeks you were not able to bike. I don't know,
right.
Right.
Yeah, that's the other thing I'm thinking is that we are living in an era in the US of personalized health care, precisely, right?
Exactly. That's what we do. Precision medicine, personalized health. Exactly.
Precision medicine. Yeah, that's great. Varda, thank you so much for sharing all of this information, great information with us. I want to remind everybody that if you're listening this now or later, you can always shoot your questions. We'll share them with Dr. Shalev. I'm sorry. Shalev. I got it.
Barlev is my partner. Okay.
Okay, well, pretty close then. Thank you, Varda, so much. Keep enjoying your Sunday. I know that you're receiving some friends today, so stay put there, okay?
Thank you very much. It was a pleasure. Many thanks.
Okay.
Bye-bye.
Bye.